Hey guys, welcome to my channel. I am Dr. Henrikson, and this video I get to finally answer a question that a lot of patients ask me, and that has to do with why does their neck pain go down their arm, or why does this pain, how is this associated with the neck? And that is radiating pain. So this video I'm going to explain what radiating pain is and how it's associated with a pinched nerve, and exactly very common places where a pinched nerve can happen in the actual vertebrae and going down in the arm. So thank you for watching. Please hit subscribe so you can see more videos, because I am definitely in the near future going to put up some videos to show you how you can actually do some exercises to help with that radiating pain. So, alright. So nerve pain can come about in many different forms and symptoms, and you can have a combo of a lot of different types of symptoms. It could be sharp, it could be stinging, you can have a dull throbbing pain, it could feel like it's burning, or you can have tingling in your hands or down your feet actually, and you can also have like shock-like feeling as well. And typically you can also have muscle weakness. A lot of patients sometimes recognize that their grip strength or some type of muscle movement is weaker than what they are used to, and those are all symptoms of a nerve pain that's associated with a compressed nerve or a pinched nerve. Now, one thing that all these symptoms do have in common is that radiating pain. That radiating pain usually travels down what we call a dermatome. Now, a dermatome basically is just where that nerve goes into the body and where it kind of innervates and does its function. So a lot of these issues can come out and they can be severely painful or just a dull throbbing, a nuisance. So I want to show you guys exactly where a pinched nerve can happen, and the most common places, and the different types of what we call the plexuses that actually go into the extremities that give your arms their ability to move, touch, feel, and all those things. Now, radiating pain actually comes from these two plexuses right here. This is the brachial plexus, which helps control your arm movements in your upper extremities, and then the lumbar and sacral plexuses, which control everything in the midsection down to the legs. It's movement, feeling, sensation, your bladder, everything goes through these nerves. Now, I just want to real quick do a recap about what your nervous system is. So, this is where your brain, this is your brain stem, and all of this here is the spinal cord. And it ends right here at L1. The rest of this here is called the cauda equina, which is just a cluster of nerves. Now, everything that you think, everything that makes you you, everything that you do that keeps you alive, your heart rate, your blood pressure, breathing, sensation, feeling, all those things go through the brain stem and the spinal cord to the brain. So all of that's called your central nervous system, the CNS. So the CNS is what transmits, it sends signals and it receives signals from the nerves and everything that's outside, and which goes out into the extremities and the brachial plexus that causes, sensation, causes you to move your arm, all these things, and they're from nerves. And all these little guys right here are the nerves. And they control more than just movement. And that's the peripheral nervous system, or the PNS, peripheral nervous system. Now, the one important thing is that all of this, all the central nervous system, all the spinal cord, your body has naturally evolved to want to protect it. So the entire thing is housed in your spine, the vertebrae. So that's all of these stacked bones and cartilage. It all houses all that important structure. So looking at it much closer up, you can see where the actual spinal cord goes through the spine and the vertebrae. So each of these vertebrae have a bony section and a disc, or a cartilage with a little soft center to it. Now, all of these, the nerve roots that we were talking about, come out of what we call the IVF, or Intervertebral Foramina. Now, these right here is the first place where someone can have a compressed or pinched nerve starts, and that's right in this area. So when we're talking about where these nerve roots can actually get compressed, the very first place and the most common place is right there in the vertebra and between the discs, in the IVF, the intervertebral foramina. Now, how that happens is there's two very common ways that it happens. Now, one of them is, the same thing right here. You got the spinal cord here, you got the nerve roots, you got the vertebrae, the bony part, and then you got the disc, actual disc. Now, you can have a disc that herniates. So the soft middle that we were talking about there, so sometimes when a disc is misaligned or you put too much pressure or too much tear in the soft part of the disc, it can pop out like that. I think you can see that. Yep, pops out. So when it does that, it pushes on that nerve right there. And that's where the first place where you get that immediate, super sharp and super extreme pain, and all the muscles try to lock up around it, and that's the nerve root saying, oh no, and it tries to protect itself by tightening up all the muscles around it. And that is a bulging or a herniated disc causing compression. And if it stays there for a long time, you get those common symptoms of radiating nerve pain that comes with it. Now, there's another one that is even more common as we get older, and that is a degenerative process called osteoarthritis, or degenerative disc disease that happens in the spine. So that happens whenever the actual vertebra, the bony part, so this is the same thing, the actual bone starts to misshape. You start to get like different types of new bone lay on there, and it just doesn't look the same or has the same space between it. So these are those nice plump discs. They look very evenly shaped, and typically as that happens over time, there starts to leave no room for the disc, the soft part, so it herniates, and then you get that constant chronic neck pain. If you turn the wrong way too fast, you get that sharp stinging pain, and that is because of degeneration in a disc or something irritating that nerve root. So those are the two most common reasons why a IVF might be what we call encroached or compressed or tightened around because of either DJD or a hernia. So as we're talking about these little nerve roots right here and how they can be compressed, now each of these nerve roots go to a very specific part of the body, and they actually do a very specific function. So typically you can trace it all the way down to the actual disc level where you might be having the problem, depending on the symptoms that you might be having. So bear with me if you will. I'm going to draw the brachial plexus, and what we're going to then it's the lower cervical, so it's the lower disc. You have C4, C5 right there, 6, 7, 8, and T1. See, 4 and 5 come together. C6 is all by its lonesome. C7, C8. And all these nerves, they all of a sudden they sprout out other nerves. So you got the subscapularis, the pectoralis cutaneous, which innervates sensation like touch, feel. That's what that one does. But we're going to hit for the major ones. That's what we're going to look at. So as they break off, and then you get the here, and then that one, and then a couple here. You have the muscular cutaneous nerve, which innervates the bicep and the forearm here. And then you have the axillary nerve, which actually helps with the deltoid, so lifting up your arms, the deltoid muscle, that's what that innervates. And then you got the radial nerve, the median nerve, and the ulnar nerve. And these are the nerves that actually go into the arm. So as we're going here, this guy goes in here, right there, axillary nerve here. Radial nerve wraps around and actually goes into the forearm here, and it innervates these fingers here. So that's your flexor muscles, all these for moving your hand up, and actually the strength and grip strength, your trigger finger and that's what that innervates. So goes around, goes into the hand on this side right here. Now the median nerve actually goes deep into the muscle and comes through the actual carpal tunnel area. So this is where carpal tunnel becomes an issue because compression of this nerve, which we'll talk about more later, goes into that nerve and innervates the palm of the hand and the fingers. Now the ulnar nerve wraps around to the other side right here, and that innervates the flexor muscles. So that's like curving your hand and grip strength, like being able to grip something. That's the ulnar nerve. Actually, too, the point right here, it's called the ulnar nerve groove. Well, when you hit it, that's your funny bone. When you hit that, you're actually hitting the ulnar nerve, and you know everyone knows that doesn't feel good. And that goes into this part of the palm, right there. So if you were to, trace this back, and actually the main issues with a lot of, degeneration or a compressed nerve in this area, you can imagine that if you had a compression at 5 and 6, you would have, loss of sensation or hypersensitivity or stinging pain in the radial nerve. If it was down here in the lower cervicals over here, some people notice lack of grip strength. Can't grip things normally the way you used to either. Now, there is also other places that's outside of the vertebra and the disc that a nerve can be compressed. So that's the second part that we're going to be talking about. So whenever you get out of the spine and you're actually traveling a little farther, you got a lot of places where the nerve, as it's going into the arm, it can be compressed or pinched, and you can have that radiating pain as well. That's not associated with the neck. Now right here, these muscles right here that come out off the neck, they're called the scalene muscles. Now these nerves like to go in between them and around them as well. So let's say you sprain your neck or you pull your neck the wrong way and you get that sharp shooting stinger pain. That is because you pulled a scalene muscle and it's tugging on the nerve. So that's another place where people can have that radiating nerve pain. Now, a big spot that's outside of the spine that you would have issues is called the thoracic outlet. And that is, see the clavicle right here and the pec minor muscle in this area? Well, it's over here. Now that kills all that goes over it, all these nerves. So whenever you have forward head carriage all the time, or your shoulders are pushed forward and you start having like, stinging, numbness, tingling, or just the achy pain in your back here, that is because the thoracic outlet here is compressing those nerves. In addition to the nerves, there's actually a lot of arteries and blood vessels that go through here that's accompanied with those nerves. So if you get enough of a compression either in the spine or in the thoracic outlet area, you can actually start to have coldness in your hands and lack of circulation in the lower extremities. And that could be a big reason people start to notice, discoloration in their hands. Now, as you go further down into the arm, there's a couple of other places where the actual brachial plexus can get entrapped and you can have that radiating pain. Now, real quick, I want to remind you guys that radiating pain starts at the point of where it is being entrapped or compressed and it goes down, okay? Usually doesn't go up, but sometimes it can. Now, these muscles right here are what innervate the arm. So if you have the ulnar nerve right here, it can be trapped right here at the elbow. It's called Tennille's elbow. Now, usually when that happens, you'll have that pain, and then people notice lack of grip strength too. A lot of the times, usually bikers that have their hands on handlebars, compression here, that's definitely causing the ulnar nerve to be compressed or irritated. Now, the median nerve, as we said a little while ago, goes through this band of ligaments and tendons, and it's accompanied with the medial ligament that goes to the fingers. And people that have carpal tunnel or compression in this area right here, actually compressing that median nerve. So that's another place where median nerve entrapment causes pain, and that's what carpal tunnel is. Now the radial nerve goes up and around here, so tennis elbow, things like that on this point here can actually cause a lot of issues with stinging or lack of sensation up here on the top of the hand. Now, I hope that I was able to explain to you guys a little bit more, like in detail, about where radiating pain happens in the upper extremities and where it's associated to into the neck. So the next thing we're going to do is we're actually going to talk about the low back and the lumbars, and the lumbar and sacral plexus. So you have the lumbars here, and then typically these right here, this is T12, T12 up here, sorry. Lumbar 1, lumbar 2, lumbar 3, lumbar 4, and lumbar 5 right there. And then you got the sacrum. So you got S1, this little rivets here, and S2. So these are where the actual lumbar and sacral plexus come out. So here we got the lumbar plexus right here. And the lumbar plexus really innervates the things on the posterior, or the anterior side of your diaphragm, and that goes to the, the inguinal place, the obturator nerve, the thing that goes between the, the groin area, and it starts to form at L5 and S2, the actual sciatic nerve, and then usually the sacral plexus goes in the posterior, the behind part. So that's your sacrum, that's your glutes, your glute major, and those nerves and the cutaneous nerves that go down into the thigh, into the calf muscle as well. Now, what I really wanted to show you guys is this is the IVF, what we talked about before, the intervertebral foramina, and that's where these little guys kind of come out, and then they go down into where they need to go, their final destination, right there. Now, typically, as we said before, I want to reiterate the fact that if you had a hernia in any of these places, you see how it can compress that area, and you can have that sciatic pain. And that is usually the lumbars, speaking from personal experience too, it's very painful and it's almost debilitating. Usually in the lumbar area, that's where I find it a little bit worse. So, now the lumbar plexus right here, you have the iliogastric and the ilioinguinal. So what we said before, it goes to the anterior part, it goes down to the inner thigh area, and it innervates the, the top and then the front of your leg at the bottom as well. And it goes all the way down and actually innervates the toes and things like that. So you get numbness, tingling, or sharp pain in the toe. You can actually trace that all the way back to a specific disc right in that area. Now, as we were talking about in the brachial plexus, and the common areas where people usually would have a pinched or compressed nerve. So we're not going to go all the way through that again because I feel like you guys got that. What we're going to talk about are the very unique points of where a nerve can be entrapped in the lower extremities. And usually there's a couple of stretches and things like that I'm going to show you guys later on in a couple of other videos that will really help with that low back radiating pain. So here we go. We got the lumbar plexus, all these nerves right here. Now what we have here is actually the psoas muscle. Now that actually connects to the lumbars here, and it comes all the way down, and it actually connects to the ilium and the hip in this area. And that also usually helps hike your hip up, and with internal rotation, external rotation of the hip too. So typically whenever you have a compressed nerve or a nerve gets pinched, how we said that myospasm or that muscle would like the spasm and get tight really fast to try to protect that disc. Now in the lumbars, the psoas is the big, culprit when it comes to not being able to straighten yourself out because the psoas won't want to relax. So doing some trigger point work or massaging into the psoas area, which I'll show you guys later, can definitely help relieve a lot of that issues whenever you might have a herniated disc in your low back. So as we were talking before, usually the psoas, it even messes with the sacral plexus. So as the sacrum or the sacral the sciatic nerve actually goes into the obturator and out from the posterior side of your body, it actually has to go through this groove right here, and where if you have a very tight psoas, it won't allow it, and it will cause a lot of compression there. So typically when people feel like they pulled their groin sometimes, that's not a pulled groin, it's actually that nerve being compressed. So let's go to the sacral plexus. Now the sacral plexus is the guy that goes right in the back, and everyone knows about sciatic pain. Everyone feels that pain in your glute or in your butt. Now the sacral plexus is plagued by a different muscle that likes to stay tight. And that's the piriformis. Now the piriformis helps rotate your leg in and out, and usually the sciatic nerve lies just under that piriformis muscle. So if the piriformis is tight, usually a piriformis can become very tight, and if you don't stretch it, or if you're a chronic runner, you can have sciatic pain because of this actual muscle and actually have no degeneration in a disc. Also, there's actually, I think it was 30% of the population that has a genetic anomaly where they actually have the sciatic nerve that goes straight through the piriformis muscle. And they usually have a lot more reoccurrences of that severe sciatic pain, because anytime that muscle gets a little irritated, it squeezes on that nerve. So that's everything about radiating pain that I hope I could put in this video. Please leave a comment. Let me know what you think. And please don't forget to hit subscribe again, and stay looking out for a couple of other videos, because I'm definitely going to show you guys a bunch of exercises called nerve flossing that will help break up any adhesions or anything that might be blocking a nerve. So I appreciate you guys for watching, and as always, stay active and healthy.